Have you heard about postpartum depression? This question is often met with uneasy silence, a testament to the unspoken reality of motherhood. Postpartum depression, or PPD, is a common yet under-discussed issue faced by many new mothers. Each year, countless women are blindsided by this debilitating condition that can cast a shadow over what should be one of the most joyous times of their lives. It's important to clarify that PPD is not the same as the baby blues. While it's normal to experience a brief period of mood swings, anxiety, and sadness after giving birth, these feelings usually subside after a week or two. This is what we refer to as the baby blues. But when these symptoms persist for longer, often intensifying over time, it could be a sign of postpartum depression. PPD can manifest in many ways, from feelings of sadness, hopelessness, or worthlessness, to a lack of interest in the baby, and even thoughts of self-harm or suicide. It's a complex and multifaceted condition that goes beyond mere blues. Understanding postpartum depression is of paramount importance. It's not a character flaw or a weakness. It doesn't mean you're a bad mother. It's a serious mental health condition that requires attention and care. Why is it so crucial to recognize PPD? Because it's more common than you might think. Studies suggest that up to 1 in 7 women may experience postpartum depression. That's a significant number of mothers who are suffering in silence, often without understanding why. The good news is that PPD is treatable. With the right support, treatment, and care, mothers can fully recover and enjoy their time with their newborn. But the first step towards recovery is recognition. The reality of postpartum depression may be a tough pill to swallow, but it's a conversation we need to have. It's time to shed light on this unspoken aspect of motherhood, to break the silence and to support our mothers in the best way we can. Knowing the signs of postpartum depression can be the first step towards recovery. So, what exactly should you look out for? Postpartum depression, or PPD, can present itself in many ways, and it's crucial to recognize the signs. Often, PPD can creep up on new mothers, masquerading as the typical exhaustion and emotional whirlwind that comes with having a baby. But there are key indicators that can help differentiate PPD from the usual new mom blues. Persistent sadness is a common sign. If you find yourself feeling gloomy or down more often than not, it might be more than just fatigue. This sadness could manifest as frequent crying spells, even when there's no apparent reason to cry. Another sign is feelings of worthlessness or guilt. You might question your ability to be a good mother, or feel like your baby would be better off without you. These thoughts can be scary and overwhelming, but it's essential to remember that they're symptoms of PPD, not reflections of your worth or capability as a mother. A major red flag is difficulty bonding with your baby. It's normal to take some time to feel that maternal bond, but if you're struggling to connect with your baby or feel indifferent about them, it could be a sign of PPD. You might also experience changes in your appetite or sleep patterns. Are you sleeping a lot more or a lot less than usual? Are you eating too much or too little? These might seem like small things, but they can point to a larger issue. Lastly, if you're feeling restless, irritable, or anxious all the time, it might be more than just new mom stress. Persistent feelings of anxiety or irritability can be signs of PPD. Now, bear in mind, experiencing any of these symptoms doesn't mean you're a bad mother or that you're failing. PPD is a medical condition, not a character flaw. It's not your fault, and it's okay to seek help. Remember, every woman's experience with PPD can be different, but what's important is to not ignore these signs. It's okay to admit you're struggling and seek help. You're not alone in this, and there are resources and treatments available to help you through this challenging time. Why do some women experience postpartum depression while others don't? This is a question many of us grapple with. Well, the causes are multifaceted, often intertwining various physical, emotional, and environmental factors. Firstly, hormonal changes after childbirth play a significant role. The dramatic drop in hormones like estrogen and progesterone can trigger mood swings and depression. Even thyroid hormones can dip, leading to symptoms of depression. Secondly, emotional factors can't be overlooked. The stress of caring for a newborn, doubts about capability as a mother, or feeling less attractive can contribute to postpartum depression. Lastly, environmental factors such as lack of a support system, financial problems, or being a single parent can also be significant stressors leading to PPD. Now let's shift gears and talk about prevention. While postpartum depression isn't always preventable, there are ways to increase your resilience. Regular checkups during and after pregnancy are key. These visits are not just about your physical health, but also a chance for your healthcare provider to check on your mental well-being. Maintaining a healthy lifestyle can also help. This includes adequate nutrition, regular physical activity, and enough sleep. I know. Enough sleep. Easier said than done with a newborn, right? But even a few extra minutes of rest can make a difference. Establishing a strong support system is another crucial element. Don't hesitate to lean on loved ones or seek professional help if needed. Remember, it's okay to ask for help. You're not alone in this journey. Lastly, if you have a history of depression or PPD, discussing this with your healthcare provider may help you to manage and possibly prevent another episode. While PPD can be daunting, understanding its causes can help you take preventive measures. It's all about equipping yourself with knowledge and surrounding yourself with care and support. You're not just a mother, you're a superwoman. And you've got this. What happens if postpartum depression goes untreated? This is a question that weighs heavy on the hearts of many, and it's our responsibility to address it with the seriousness it deserves. Untreated postpartum depression, or PPD, can have profound effects on both a mother and her child. For the mother, PPD can escalate into a chronic depressive disorder or even a severe case of major depression. This could potentially lead to debilitating conditions that might interfere with daily activities, making it difficult for the mother to care for herself, let alone her baby. The effects of untreated PPD also extend to the child. Studies have shown that children of mothers with untreated PPD may experience developmental delays, difficulties with social interaction, and higher susceptibility to anxiety and depression later in life. These are not inevitable outcomes, but they underscore the urgency of addressing PPD. But there's hope. Let's shift gears and talk about treatment options. Therapy is a common and effective approach for managing PPD. Cognitive behavioral therapy, for instance, helps mothers change negative thought patterns, while interpersonal therapy focuses on improving relationships and communication. Another treatment option is medication. Antidepressants can be effective in managing PPD. However, it's important to remember that not everyone with PPD needs medication. Each person's experience with PPD is unique, and so should be their treatment plan. It's crucial to consult with a healthcare professional to discuss the best course of action that aligns with personal needs and circumstances. In some cases, a combination of therapy and medication can be the most beneficial. But again, this varies from person to person. Treatment doesn't stop with therapy and medication. Lifestyle changes like regular physical activity, a healthy diet, adequate sleep, and a strong support network can also play a significant role in managing PPD. Seeking help is crucial. You are not alone in this struggle. Remember, it's okay to reach out, to ask for help, to share your feelings. You're not alone, and with the right help and support, you can navigate this journey. How long does postpartum depression usually last? This is a common question, and the answer varies for every individual. On average, postpartum depression can last for several months, but in some cases it may extend to a year or even longer. In the best-case scenario, with early detection and appropriate treatment, some women start to feel better within a few weeks. Regular therapy sessions, lifestyle modifications, and perhaps a short course of medication can help mitigate the symptoms and accelerate recovery. But remember, it's not a race. It's about feeling better and reclaiming your life, one day at a time. On the other hand, the worst-case scenario can look quite different. Without treatment, postpartum depression can persist for years. It can morph into chronic depression, impacting not just the mother but the entire family. The world can seem like a dark place, and the joy of motherhood can feel overshadowed by a cloud of despair. However, it's essential to reinforce that postpartum depression is treatable and that there's no shame in seeking help. There are numerous resources available, including medical professionals, support groups, and online communities, all of which can provide assistance and support during this challenging time. Remember, it's okay to ask for help. There's no set timeline for recovery. Postpartum depression doesn't define you or your journey as a mother. It's a condition, and like any other, it can be managed and overcome. So hold on, keep going. You're stronger than you think. Postpartum depression is a serious but treatable condition. Remember, it's crucial to recognize the signs, seek help early, and understand that it's not your fault. It's a complex interplay of hormones, life stressors, and individual susceptibility. It can be severe if left untreated, but with timely intervention, it's manageable. It's different from the baby blues and doesn't necessarily mean lifelong medication. The duration varies, so there's no one-size-fits-all answer. If you found this video informative, please hit the like button and share it with someone who might need it. Subscribe for more interesting and educational videos. Thank you for watching.